Hello friends, today we are going to think on how are we going to retain the patients. You see, in homeopathic practice, what I have experienced is that we get the patients, but initial practice we cannot retain them. There come new patients. We do very hard work in my practice also. I used to take a detailed case taking, then I used to repertorize, I used to think a lot and give remedy to the patient. After one or two visits, he may not turn up. So it was a very difficult for me, and I was thinking why I cannot retain. Yes, there come more and more patients, but you see, one secret of your practice, it is not the number of new patients comes to you, it is the patients you retain. That is a very important thing, and why we can't retain the patients. The first thing is that whenever a patient comes to you and you are a new doctor, he comes to you in a different expectations and he asks you some questions. And here is the secret. Here is the thing that how you talk to him. Because anyway, you are a new doctor and many times you give more promises. You talk a lot to the patient. You're in a hurry. You're not in you are not a patient. You need to have a patience. Simply what I did when I understood and when I studied is that whenever a patient comes to you, number one, we know we have the patients of chronic diseases. They have gone to number of doctors. They have the big files. They come to you. The first thing I do is that I go through his file. And while I'm going through his file, he asked me questions. Doctor, will I get ready? How much time will it take for me? Is it treatable disease? Will you able to cure me? Are you confident, or any other doctor you want to refer? I said, just be patient. Let me see your case. Very patiently go through a case and ask him, please don't disturb me. I want to see your case and I will tell you afterwards, not in the very beginning. Many times we do a mistake. Patient comes to you and say, yeah, I got allergic rhinitis. Oh, yes, I can do it. And I have treated so many cases, this patient, that patient. You start advertising yourself. You start explaining himself. No, you are not going to explain at all. You're not going. He will also ask you how many patients you treated. I said, sorry, let me see your case. I have treated many cases, but I don't know whether I will be able to treat your case. And in order to treat your case, I have to study your case. So be patient. I want to go. I'll go throughout the case, and while going throughout the case, I will understand the number of doctors he has gone, and he has gone to number of other physicians, and what he has taken treatment, how long, and what was the result. Then I will say, okay, I have seen your case. Now I want to ask you certain questions, and these questions are very important for your treatment. And if you give me proper information, then I may be able to help you. The another thing, you should be very clear and go throughout case, study his case. When the case is studied, or many times you'll find it is very difficult patient, and you may ask me, okay, you leave your papers with me, I will study and you come afterwards. Rather, this builds a confidence in a patient that doctor is very sincere and he is going to study your case. So many times I also used to find some negative patients, and I used to tell them that, okay, you come afterwards, I will see. And that build up confidence in me. I studied the case and all these things. Then comes after the prescription. You never say that I have given a medicines and you will feel better in 10 days, 15 days, or anything. Never a promise. No doctor on the world, on this universe, on the earth can promise that he has given a medicine and there will be exactly the results. We don't know once we are given a medicine how it's going to act in your body. Any medicine, any system. So you say, okay, the best of knowledge, I have given you medicines. You take the medicines and let me know after a month what happens. He will ask you another question, doctor, will there be an aggravation? You say, I can't say there will be an aggravation, but let us see. Some people do get aggravation, majority of them don't. But if you get an aggravation, let me know. What can I do? So always have a question, always be scientific, and then the patient will say, yes, this is a proper thing. On the other hand, many times we think that if we want to return the patient, we should promise him, we should predict that this and this and this will happen. No, If you predict and if it doesn't happen, then that is difficult. But if you predict it happens, again he will expect you more, and which you will not be able to fulfill. So always be clear whenever the patient comes again, and if he says he has aggravation, okay, I will see what has happened. You just go to this, you see what is really aggravation or not. Many times I feel patients come and they say there is aggravation. When I go through detail, asking him one or two, three questions, he said, "Doctor, ye kam hua hai, it is less, it is more, it is yes, it is better." He himself explains, whereby in the first instance, don't believe him and don't be hurried to make a decision. Many times patients, I am better, but it is not there. Many times it's opposite, but only after an examination, after proper things, you come to a decision. And your patience, your sincerity builds the confidence in the patient. It's not that your promises and false promises and your big list, all these things. Even if it is an aggravation, if you are gonna, you think that you need to change the medicines, don't tell him that it's a medicine I have given wrong, all these things. Or say, okay, it's okay, I will do it. I will just make some changes in your medical medicines, and let us hope what happens next time. That also is what happens next time. Be scientific, be sincere, and this will gain a patient's confidence. So this much is enough. Tomorrow I will tell you the different ways of dealing with different types of patients. Patients come to you for different things. Some patients comes for you for the treatment, some patient just comes to examine you, some patient just wants to compare with other doctors, or many times I know patients come with from other doctors just to check you, or might be they might have sent you, say the patient to you, just to check your knowledge. So how to identify these patients, how to convert these patients, how to make your image strong in the patient community, we'll discuss in the next. Thank you.